Dental hygienists are now seeing their roles in a dental practice differently. They're no longer just coming in to scale teeth. They're actually coming in because they know that now they're saving lives. We know that the bacteria that's in the mouth can travel through the system. When it travels through the system, we know that it can lead to other conditions. There's research now that talks about bacteria in the mouth and dementia, bacteria in the mouth and different cancers. We need to make sure as hygienists, preventive specialists that we are, that we're collecting all that information, that we know exactly what we need to do to educate our patients in order to try and reduce the bacteria that's in the mouth. And we take pride in this. We work hard to be able to do this. We have so much to give. We're educated. We're specialists in what we do. Dental hygienists, we're not just trained on the job. We go to school for almost a full 3 years to get our degree in dental hygiene. It is important for us as hygienists to attend continuing education courses. We can bring this information back and we can apply it to our clinic care. It doesn't stop when they graduate. It continues for the life of their profession. Before the dentist comes in to see the patient, we're providing comprehensive assessment that includes blood pressure screenings, oral abnormality screenings. We're looking at the tissues in the mouth to make sure that everything looks healthy. Gum assessment, where we take measurements around the teeth and ensure that you don't have periodontal disease or gum disease. We're actually looking to make sure that anything that's happening in the mouth that may be leading to other systemic conditions in your body, that we're controlling that. And we take pride in doing that. Your visit isn't going to be a sit in the chair, get your teeth cleaned and leave. It's going to be a visit that's very comprehensive in nature because, as I said, dentistry is moving from just taking care of teeth to taking care of the whole body.
The federal government has finally classified the dental hygiene profession as a healthcare treating and diagnosing profession. Yes, we may have been thought to be tooth cleaners. In the past, I was called the dental nurse. But now, more importantly, we are out there saving lives. We teach not only about the mouth, but we treat the entire person. Our dental hygiene students are our legacy. They are our future. They are the new faces of dental hygiene.
Unfortunately, many patients only view the role of the hygienist as to clean their teeth every 6 months. I encourage people to use that hygienist as an advisor on how they can improve their future health based on the health of their mouth. When I identify someone with early cardiovascular disease, my goal is to prevent the heart attack, not wait until they have a heart attack. And there's one patient in my practice named Melanie. Melanie, when she first did testing, we have the special artery testing looking at the carotid artery, and what it does is it tells us at what age that person's artery would be average. And what we found out in Melanie was that her artery was the age of someone 16 years older than she was. So when we started looking into all of her reasons for why she had this advanced age on her artery, we found out that a big contributor was the bacteria of her mouth. And what was really exciting was that over a 5-year period, Melanie was able to decrease the age of her arteries from that of someone 16 years older than she was to 5 years younger than she was. So she lost 21 years on her artery age. She actually found the fountain of youth. She got younger, not older. What was unique about Melanie's case was nothing changed except the health of her mouth. She didn't change her exercise, her nutrition, her weight, her medications, nothing else. The only thing that she did was cure her periodontal disease. So it was with the work with her dentist and hygienist, she was able to improve the health of her arteries.
I worked with dental hygienists from day one. I experienced the value of what they could add to my practice, not just the clinical aspect, whereas they had 2 sets of eyes now, 2 sets of educated eyes on our situation, on the patient, and the personal touch that added to it, because it was clear to me that people would talk and say more important things to their hygienist than they would to the dentist. You may be as surprised as I was to find out that over 48 million people in the United States live in areas where they're experiencing dental shortages, dental care of all types. And I think it's important that the dentists and hygienists get together and work together to do something about this and try to provide some more care in these areas, because it's certainly needed.
We feel that it's so important that hygienists are utilized to their fullest capabilities, that when there is a need in a low-income dental setting or a clinic, that they can utilize us and bring us in to provide the care that these patients need. And hygienists are very willing and capable to do this. As a preventive specialist, we are in a unique role to reducing those healthcare costs that our nation struggles with so much. We know that 64.7 million adults struggle with gum disease, periodontal disease. But it's not about the numbers, it's not about the statistics. It's about every person. We can actually help to provide education that teaches you how to prevent disease in your mouth, so that we know that we're actually contributing to your overall health. We as dental professionals shouldn't wait until it's too late, until your gums are bleeding, until you have holes in your teeth, to actually educate you on how to prevent all of this. This is the focus of the preventive specialist. This is what we want to do. This is what we're educated to do. This is what we're passionate about. And this is what we want to strive for, is to let you know that there is someone out there that can make a difference in your life. Hygienists are capable of providing you with the vital tools that are necessary to make a change in your oral health, to make a change in your overall health.